Welcome to Press Talk on Television Nigerian. I am Daniel Atai. It is no longer breaking news that President Muhammadu Buhari tested negative for COVID-19, while his Chief of Staff, Abba Kyari, is allegedly said to be positive to the virus. Nigeria's President Muhammadu Buhari has tested negative for the COVID-19 virus following a test for the disease that was carried out on Monday, which is yesterday, on the president by the Nigerian Center for Disease Control. This day confirmed. The NCDC has informed the president on the outcome, his negative result this morning in Abuja. According to presidential sources, the test for the president was necessitated after his chief of staff, Mr. Abba Kyari, tested positive for COVID-19 on Monday. Kyari had traveled to Germany on Saturday, March 7th, to meet with officials of Siemens in Munich on the Nigerian electricity expansion program. He returned exactly 1 week later on Saturday, March 14th, but did not show any symptoms. He was said to have been at a meeting on containing the COVID-19 pandemic in Nigeria all through Sunday, where he reportedly started to cough. Subsequently, he voluntarily submitted himself for testing and was informed of his status on Monday. Kyari has, however, gone into absolute isolation following the test result. However, report is still saying that he probably have been flown to Lagos, we gathered from these days. But his condition is hale and hearty, apart from the occasional coughing. And then we will be discussing, in addition to this COVID-19 in Aso Rock, the state of our health facility, especially the National Center for Disease Control in Nigeria. And with me in Press Talk today has been, is Peggy Shandy, an ace journalist, and my fellow comrade, usual Press Talk, co-discussant, comrade Silvanus Okpe Esquire. Gentlemen, welcome to Press Talk.
Thank you for having us.
Now, let me begin with you, comrade. COVID-19 seems to have arrived at Aso Rock. What does this portend right now for the FG and for our health, workers? Or the situation of our health facility in the country?
The situation calls for worry. If you understand the strategic position of the Chief of Staff in the presidency, you know that this has passed on to many Nigerians, because the Chief of Staff controls the activities in the presidency, and for anybody to visit the president, he must pass through the Chief of Staff. And he has been on ground since the 14th that he came back to Nigeria from Munich, receiving visitors. He did not go into isolation. This is one thing we must make emphasis on, that nobody is above the law. The presidency and the NCDC has been happy on the need for people coming down from abroad, especially in this country where they have high cases of coronavirus, like Europe as a continent as a whole, should always subject themselves to self-isolation for at least 14 days. But it is unfortunate that the Chief of Staff to the President did not observe these directives. He didn't follow the directives. Rather, he started working on that 14th, went to many places. There are even rumors that he attended the burial ceremony of Governor Yahaya Bello's mother, where he met and exchanged pleasantries with many highly influential citizens. So this is dangerous. I don't know where it is.
All right. I'll come back to you. Aso Rock has gotten a case of COVID-19. What is next? Should everybody be quarantined, be tested, or what is the way forward now for the presidential villa? Is it a total lockdown?
In South Korea, thank you very much for that question.
Yes.
In South Korea, when you are diagnosed of COVID-19, SARS-CoV-2, they shoot you to death.
But we are not in South Korea.
North
North Korea.
Yeah, North Korea.
Okay.
They shoot you to death. to exterminate all these the traces of all the SARS, the COVID-19, around, so that you don't come to transmit to people. If you go to Russia, they released 500 lions
But these
and
are not substantiated.
800 tigers to lock down the hospital, the entire system down. Nigerians, sit down in your house is a problem.
Okay.
Now, to sit in your house is a problem. They love to travel all the time, keep traveling abroad and all these things. They pack our children.
As for the chief of staff, he went to discuss the cement company on the Nigerian electricity problem, and also this COVID-19 issue in Germany. The report from this day we got says so.
We saw it. So you went to discuss about coronavirus catch you.
You went to the power expansion.
The power
Power expansion.
Yes.
In Munich.
Yes.
And then he also went to discuss what they can do to be able to provide drug systems. Yes, I saw it. And the issue is, you went to discuss something that will bring development to Nigeria, and then you ended up bringing problems to Nigeria. I pray that they will lock down that Aso rock and nobody will come out.
All right.
But people have been going in and coming out since 14.
Yeah,
So cannot
and
be sure
we saw
It's very possible that even the numbers they're saying that people are
it's
considering
not
considering the sensitivity
he
of
had
the
had
office.
meeting with the governors forum,
sensitivity
Which one of the governors are infested?
and we have had
He was at FEC meeting on Wednesday.
Yes.
Everybody in the
He
FEC
was at this meeting where they
all the
discussed
people in
containment
the
of
all the
virus.
people in the neck that
All
Abakari has
our
already,
governors should go into.
they should go into isolation. Leave
we
us in
saw
government.
Kogi State governor with him as he returned. And
The news
some
reaching
other-
me from Punch 9 that Bauchi State governor just tested
Bauchi State
for coronavirus.
were in trouble in this country.
because yesterday he said he had a contact with Atiku's son,
and he went
and he
into
went into
self-isolation.
yes,
And he has been meeting with governors even on Wednesday, meeting the Federal Economic Council chaired by Simbajo on Thursday. And these meetings these people are not just careful. They have brought bad leadership to Nigeria, and now they are bringing bad sickness.
Bad secrets.
That we cannot come out of.
When last did you
What
travel
have
to
you
UK?
done to
When
this?
last did you travel to
Have
UK?
I been to the UK before?
This
is not a disease that common men bring to.
No, come on, man.
They have brought all the woes that have.
all right.
I'll
Do we hold on? Let me. Do we now, ask the Aso Rock Villa and the National Assembly to carry out a test for all the legislators, both at the Senate arm and the House of Rep, so that we will ascertain the numbers of persons already that must have contacted or been infected with this pandemic virus. Is it time for it now? Is it time?
I think it is even long overdue.
It's long overdue.
There are many of them who came in from abroad. I saw a memo written by the Federal Ministry of the Minister of Health to the National House Speaker of the House of Reps.
Oh yes.
Demanding that the Speaker directs members of the House of Reps who came in from abroad to submit themselves for quarantine because they have refused. That is what I'm saying. We have not submitted ourselves to the rules we made for ourselves.
All right.
Some people are seeing themselves as being above the law.
Yeah.
And that has caused a lot of damages for this.
You are correct. We'll come back to that. After this brief timeout, Press Talk continues, and we'll still be talking about the state of the National Center for Disease Control. Stay tuned. This is still Press Talk on Television Nigerian, and we are still talking about COVID-19 in Asrock, and it seems it is moving to state government houses. Apart from the report that Abba Kyari, the Chief of Staff to Mr. President, tested positive to the virus, a report just coming to us now has it that Bala Mohammed, Governor Bala Mohammed of Bauchi State, just tested positive to the pandemic virus. And now, Mr. Peggy, what do you think is actually the state of our National Center for Disease Control? Are we ready to contain this disease?
Thank you very much. It's a problem in Nigeria that until you become overwhelmed with circumstances or a situation like this, then you will not be able to start early. You know, when we started the procedure of having understood, you know, how Nigerians think, you know, until Atiku's son is falling, now Abba Kyari is coughing ceaselessly in the villa.
Actually, it's a sad one, and our hearts goes to them. We also felicitate with them in this particular condition.
Considering his age, and then he has been coughing since 2 weeks ago. He has not stopped coughing. I mean, it's really pathetic.
No, the state of the health facility.
The state of
can it contain coronavirus in the country? It has become obvious that the thing is hitting even the state government houses now. He was with the governor.
No. Let me tell you. The state of the disease control centers in this country are in shambles. To be very candid, they did what they could when Ebola came. And part of what they're using, the equipment they're using now, is those Ebola equipment. Yes. So they are carrying over, and you know, SARS-CoV-2, which is called the COVID-19, is different. It's manifesting in both the flu inflammation and the sores. Ebola was just bringing just fever and fever and fever, but it was killing too. You know, the manifestation of this particular virus is becoming very difficult for these facilities to manage them. And I think that is where the answer is absolutely, it is impossible that the health centers can overwhelm.
Okay, now, thank you very much for that. Do you think that we should collaborate? I think today the federal government is making effort to liaise with the Chinese government on how the drugs they are using, you know, the curative drugs, because I could say the curative drugs, because China has used the favipiravir and the Avigan drug to have discharged more than 91% of those infected with the virus. Is it now for us to liaise with them for the drug, despising the NATO politics? And when I mean the NATO politics, there is this power play among the super world leaders who should be first pronounced as the developer of the drug, just like we are waiting for the United States. China has come out that they have the drug and they have contained vividly and evidently some cases of the pandemic. What is your take? Do we liaise with China now?
Well, before I go into the curative drugs, I want to first talk on the preventive measures, which if are not done now, our case might be worse than that of Italy. Now, there are established cases in Lagos and established cases in Abuja, and there are many persons who might have it too and are not diagnosed. How many places in Nigeria can they carry out the test of COVID-19? 2 places, only in Lagos and in Abuja. So if you have it throughout the southeast and the south-south, you are on your own as we speak. So this is the situation. Why, before talking about how to cure, why not talk of protecting the others? How many of the drugs we call will be brought in to cure when everybody has the disease? Let us create isolation centers. How many states have functional isolation centers? If you call the toll-free number of NCDC, they don't pick sometimes. Let us talk of the basics. Let us talk of proactive measures. Let us talk of preventive measures that the government must take to prevent people while finding solution for the others. Now, only 2 places in Nigeria have the ability to even house these people. because of the contagious nature of the virus. The pathogen that is used to test for the testing, for the diagnosis, cannot be handled in any laboratory because of the contagious nature. There are levels of laboratory that can handle it. Like I said, it's those Ebola facilities that they are using today. Those people need ventilators. How many ventilators?
Do we liaise with Chinese?
Let us liaise with them
now
on preventive measures first before we talk, because everybody, as it goes now, every day, new numbers are coming up.
Yeah.
It keeps rising. How do we prevent it from rising?
The medical director of China on the 17th of March said they have discovered that the Japanese-made Avigan, which is favipiravir drug, is effective in the treatment of coronavirus. 91% effective. So what are we waiting for? That is my question. What are we waiting for?
So do we wait to get infected?
Do we? No. The question is, do we wait for the World Health Organization and the Food and Drug Agency, under which the commissioner is from the United States of America, to pass a vote of confidence on these drugs before we start using them, having seen vividly that the Chinese government has discharged those infected with this drug and with this virus from the hospital and have maintained their status as negative?
Let me explain
So
something.
what do we do now?
Let me explain something to you.
Yes.
It's a very good analysis you have just brought up.
Yes.
Mr. Dan.
Yes.
I want you to know that just like Sylvanus Okwe has mentioned, he has said before he goes to the curative, he wants to finish or deal with the
preventive.
And that preventive is very important. Okay. Now, you asked us whether the disease control centers
Yes.
are actually, right with equipment or
ready to take in.
armed. When
Yes.
you're talking about being ready or armed,
I remember when you first went there.
I went there.
One of the hospitals you were arrested.
I was arrested.
And the spokesperson of the IGP came out
Yes.
to say that
We are just
you people
Abuja
were-
residents.
You people were just making
Pranksters.
bastards, and
now
the result has come out.
I want to put it to that same man who was saying we are just ordinary pranksters or whatever. I'm a journalist.
That you were
With television
that
Nigeria.
you guys were creating pandemonium.
Panic.
A panic.
The panic that has
we
come
are there
now.
now.
We are here.
We're
now.
just there.
So we are here now. What are they doing? They will all run away, all of them. But I pray that God helps all of us in this country.
Yes.
I'm a patriot.
Yes.
And I stand firm
Yes.
to save Nigeria with what I want.
And that was
Let the power play.
And that was
No.
that was quite an investigative.
It
one.
was investigated.
Let me talk about curative.
No. I will come back to you. It is important to know that they should expunge power play between America and Chinese out of this system.
Exactly.
Now you know that hydroxychloroquine
Yes.
is on a clinical
Test, yes.
It hasn't even gotten to the
And with the enormous side effects it cannot be said to be accurate for the treatment.
Avigan has been proven
Yes.
that no further infested, no other Chinese in Wuhan or the entire China has been further contracted, with the coronavirus.
Yes.
They are containing those ones who are already there and then trying to make away those ones, and they have recovered and they don't want anybody to get infested anymore.
Yes.
And then they have also increased the sanitization of
They are
the whole
country. They are fumigating their street.
fumigating it.
They have the technical know-how.
In Nigeria, you
the
say
technology is there. They are street to street.
Now,
Quarantining.
lastly,
Yeah.
and then you say isolate yourselves in Nigeria.
Yes.
No centers to even go and test this COVID-19. Just like Okoya
This is a
said.
serious situation.
And then you isolate yourself, and then you say no
die
distance,
inside
then you die inside the room.
Now, when we isolate ourselves, let's say on a preventive measure, the federal government has declared that we take some precautionary measures and sanitation. If we are locked down, how do we feed? Will the federal government feed us? Just like we see
in UK, US, in Canada,
in Asia. What do we do now? This is a big situation. even the hunger alone is enough to kill people.
Hunger will kill more than
before
coronavirus.
the coronavirus. That's because you see, people have to work. And if offices are closing down and they pay you off per se, how do you survive after that stipend, is exhausted? This is a serious situation. And I think I am trying to call the federal government to revamp what we call Operation Feed the Nation. They have to feed the nation. And I don't know whether we have the statistics and the data analysis, but what do we do? What
Let
now?
me say it now.
Yes.
It is unfortunate that at this moment we have come to feel the impact of bad leadership that has been in Nigeria since 1960. It is unfortunate that now that the country has been bedeviled with such a deadly virus, we don't have simple leadership over the years. Now. One, no hospitals to treat those persons. No hospital with ventilators, with the facilities needed to treat this coronavirus. Coronavirus can be, people recover. It can be treated.
Yes.
The Italian who first brought it to Lagos has recovered fully and is negative. They treat those symptoms. They treat your cough, they treat this one, that's how they treat it till it goes down. Early detection matters. But now, increase, we don't have where to keep them. Which hospitals will contain people?
Honestly,
if this thing come up, so we don't have responsible leadership, and this is an eye opener.
It's an eye opener.
Our leaders have seen that when a situation will come one day when abroad their monies cannot save them.
Yeah. That is where
When
we are
their
now.
monies
Hold on there. That is where we are now. We have been just a minute. We are taking off the program. The state of our primary, secondary, and tertiary healthcare that we have been, blowing the horn. Don't go abroad for treatment, for medication. Ensure that your country is adequately equipped to see to any outbreak of diseases or the outbreak of pandemic like this. It has come. Is it obvious? Do we begin to invest in medicine now in this country? Thousands of our medical doctors are in the US, in the UK, in Asia, and they are doing quite well. Just of recent, you heard that the ones in the FCT, they wanted to embark on strike. It has happened in Ogun State, in Lagos State. Our medical, personalities have not been taken good care of. What do we do now? Do we start looking inward? Those medical staff that we have on our facilities, what do we do now in the case of COVID-19? Is it a lesson?
It's a big lesson.
It has become obvious.
Nigerians are going to use their lives to pay dearly for this experiment on COVID-19. To begin the process, maybe from our children, to begin to rebuild this country and be patriotic enough so that these situations, do you want to hear from my mouth that the secondary, primary, and all the tertiary hospitals are all dead? Thank you.
Anyway, that is where you have a minute. Okay, that is where press talk will stop today. And I think the federal government, the fact that the chief of staff to Mr. President Abba Kyari has tested positive is not the end of the world. I think we could still be reactive enough and be proactive in the areas where this COVID-19 has not entered. However, our medical personnel should be patriotic enough, and the federal government should shun every iota of politics to ensure they are properly taken care of, and we begin to liaise immediately with China.
Stop telling us to isolate yourself.